Okay, for my postpartum assessment, I would first knock on the patient's door, introduce myself, identify the patient using 2 identifiers, provide for privacy, explain what I'm about to do, and wash my hands. I would first ask the patient if they voided within the first hour. If they haven't, I would let them go ahead and do that at this time. And then I would take their vital signs, respiratory rate, O2 sat, temperature, pulse, and blood pressure. So then I would first begin with breasts. I would want to ask how they felt, if there's been any engorgement or discomfort, if they're soft, hard, inverted, exverted, if there's been any warmth to them. I would also feel to see if there has been and what the color of them are. I would also want to ask if they've been bottle feeding or if they're breastfeeding. So then I would move on to uterus. I would want to support the bottom and feel for the fundus. I would want to see if it is midline or if it is deviated, maybe due to a distended bladder. And then I would also want to see if it's firm with massage, or if it's boggy. It should be firm or firm with massage. Boggy is not good. At this time, I could also check for lochia and pull the pad down while I'm doing it to see if there's any free flow when massaging the fundus. So then I would move on to bowels. I would first check my bowel sounds, and then I would ask them when their last bowel movement was, odor, color, if they've had any hemorrhoids, any discomfort when using the bathroom, if there's any abdominal distension, and I would also want to see how their appetite is as well, if they've been hungry or haven't been eating, and so forth. So then I would move on to bladder. I would want to note the color, the odor, if there's been any clots, any discomfort, abnormalities, when they last voided, if they have a catheter or if they've been using the bathroom by themselves, and if I need to, I would note the amount as well. So then I would go to lochia. I would want to note if there's any rubra, alba, or serosa. If there's any clots, the clots should not be bigger than a golf ball, and they should be mashable to be normal. And I would also want to know if there's any foul odor, the number of pads they've been using, and when the last time they changed their pad was. And then I would move to episiotomy. At that time, I would check the perineum, ensure that it looks normal. I would check for redness, any edema, which edema is normal the first 24 to 48 hours. If there's any bruising, there should be no discharge, and it should be approximated, so there should be no opening or bleeding from that. And then I would go on to Hohenstein. For Hohenstein, I would ask them to relax their leg, and I would support the back of the knee and then press the foot up and ask them if they're having any pain or tenderness. If they say no, I would then go ahead and check their extremities. I would check their pedal pulses, and then I would check to see if there's any redness or warmth, and I would do that to both legs as well. So then I would go on to check their emotional status. I would want to basically observe and see how they're doing, see if they are happy, sad, fatigued, if they've named the baby yet, how they're interacting with their family and the baby, and what their energy and activity level is, and also see if they are bonding with the baby. Then I would document and report.